Hi hygienists, Ziv Simon here, and together with Dr. Alex Waldman, we wanted to thank you for attending last week's study club meeting at Wolfgang's Steakhouse in Beverly Hills. It was great to have you. I hear it was a great evening. I'm so sorry I couldn't make it, and I apologize for that, and I'm glad the ones that attended had a great time. I hear you didn't let the speaker leave, so it must have been good, and he's a great guy. I spoke to some of you already about the lecture and about Dr. Champagne, our speaker. And if you're interested, we can always bring him back next year. It's not a problem. His practice is right in my building, and he enjoyed the evening as well. And I'm glad you found everything he talked about very useful and interesting. He's really at the cutting edge of plastic surgery. He's an awesome guy, a great surgeon. And he offered to extend the courtesy consultation in his practice to the members of our study club. So definitely take advantage of that. Not that you need that, but just in case you're interested, he was kind enough to offer that. Now, he also showed you a case where he treated one of my patients that basically damaged her lip after a procedure because of local anesthesia. And I hope the message came through. When we are anesthetizing patients, especially for a mandibular block, we need to warn the patient about this type of damaging potential, because it can be devastating if the patient bites their lip, lower lip, and creates this damage. And luckily, Dr. Champagne, with his surgical skills, was able to correct the problem. So I wanted to give you a little bit of background on this case, so you have a little bit of background on the procedure that led to this problem. And if you like this format, we can definitely shoot more videos in between our study club meetings, so we can keep in touch and increase your knowledge and create a lot of content for you, so we can all learn together and get better. And it's a lot of fun to keep an open communication this way. So this patient came in with, as you can see, an 11 or almost 12 millimeter pocket on the buccal aspect. So you must see that this is a problem. And the story is that this tooth was fractured for many, many years. You can see the periapical lesion around the distal root that was fractured right in here. So this was a hopeless tooth for many, many years. The patient's dad is actually a dentist in Australia, whom I met through some of my lectures, and he referred his daughter to me. And in reality, this tooth needed to be extracted a long time ago. And when the patient was ready, we extracted the tooth. Now, if you see a 12 millimeter pocket on one aspect of the tooth, you can anticipate that there's no more bone. And this is the surgical site after the tooth was extracted. So what you're looking at right here is the second molar, and here's the premolar, and this is where the tooth was extracted. And you can tell that the buccal aspect of the site is missing. Okay, it's like a dehiscence once you take the tooth out, and there's a lot of infection inside. So anytime you're probing a deep pocket, in one localized area, you can anticipate a lot of bone loss. So what I needed to do is reflect a large flap, basically detaching all the gum tissue from all around the bone, or the existing bone, so I can expose the border of this defect. And there are two reasons why I needed to do it. Number one, it allowed me to gain access to the infection and clean all this infective material. Number two, it allows me to graft the area and use membranes and growth factors, and that's in an anticipation for placement of an implant a few months later. So in these situations, when there's a big infection and no bone on the buccal aspect, we typically don't place an implant immediately. It's not a good idea. Too much infection. So what we do, we graft the area with some bone graft. We now use platelet-rich fibrin. If you're ever interested in having a lecture on that, let me know. We can definitely talk about it more in our study club meetings. But for this patient, I used the bone graft, the platelets, and a collagen membrane. And you can see the area now sutured with gut sutures, and basically we let it heal for about 2 to 3 months. That's usually enough before we evaluate it for an implant. And this is a couple months later. You see it all healed, and you can look at the ridge. It has a reasonable dimension, and it has good tissue quality. And we see this time and time again, that once we remove the source of the infection, the jaw, assuming the patient is healthy and we do all the right things, we follow our protocols, the patient can heal very well and is a good candidate for an implant. Now, it's not enough to look at the area and just place an implant, obviously. We get a CT scan that allows us to digitize the whole process so we can really map the adjacent teeth. You can see them here in gold, kind of. We can map where the nerve is. We can map where the mental foramen or the mental nerve comes out through the jawbone. And it allows us to plan an implant in the right position and also the anticipated crown. So there's a lot of information that we're getting in the planning process that allows us to position this implant, actually now virtually, and communicate with the patient's dentist and make sure that once this implant is placed, it's in the most perfect position. Now, in the same software, we create a computer guide. You can see this ring here. Again, at the moment it's virtual, but we will translate it. We will print an actual guide that fits on the patient's teeth. So once we place the implant through this ring during the procedure, this implant will be placed in the exact same position we planned on the software. So that's an element of accuracy and precision, but also safety, because the system doesn't allow us to go deeper and damage the nerve. So we have a leeway here. We have a safety zone. So this is an awesome way to place implants. And we've had great success with this system over the past years. Here you see the final position of the implant when it's ready to be restored. And this is the final crown done by the dentist. So basically, if you remember, it was a big disaster with no bone, no buccal plate, big infection, big disaster. But all these things can be corrected and the patient can get finally a tooth. Now, this was a great procedure, but in order to accomplish it, we need to have good and profound anesthesia with a mandibular block or inferior alveolar block. And this patient unfortunately bit her lip pretty bad and needed to be referred to Dr. Jason Champagne, who did a really fantastic job. I was so impressed to see the results after the procedure he did. And she has a tooth, she has a great lip, and she's in great shape. So I'm glad he was able to share this case with you. Feel free to give him a call and just make sure to mention that you're part of the Dental Hygiene Study Club of Beverly Hills, and he promised a courtesy consultation. So I think it's very nice of him, and we hope to have him back next year. A couple of other things that you may be interested in. I personally have a teaching brand called The Surgical Master, and there are a lot of videos. They're really meant for dentists and doctors practicing surgery and trying to get better, and even specialists subscribe to that. You may find it interesting just to extend your knowledge. And of course, if there are any promotions or anything that I prompt to buy or to enroll in, you don't have to. It's not really for hygienists, but I found that there are now more and more hygienists subscribing to it and just learning about the different surgical options. So you can basically go to surgicalmaster.com, fill in your name and email, and you'll be getting weekly emails from me with videos and interesting information and procedures and stuff like that. And I also post similar videos on our dental hygiene Facebook page and my own Facebook. And although these are not procedures that you personally perform because you are specialized in dental hygiene, your patients require these procedures and may ask you questions and may ask your opinion. And I think knowing a lot of things out of your scope of practice is going to make you a better hygienist, and it's going to help your patients, which is the ultimate goal of why we practice. So I hope you can check this out. Before I sign off, I wanted to share with you one of my efforts in the past couple years to help patients with gingival pigmentation and help those patients that are unhappy with their black gums pretty much get their gingiva much pinker and complement their smile. And we now have a unique and minimally invasive procedure to help patients with this problem. We have now quite a bit of experience and great results and great follow-ups to show. And I'm going to share this with you in our study club. But if you have patients that have this problem and are frustrated and don't know what to do, you can definitely use us as a resource to help these patients. They can consult with us and we can determine if they're good candidates for that. And most patients are. So definitely take advantage of that, and feel free to email me or call me if you have any more questions, if you'd like to know more about that. Happy to help you with that. So we look forward to seeing you in our next study club meeting. That's going to happen December 9th, 2015. Again, same place, Wolfgang's Steakhouse. I'm going to be speaking about how to deal with complications and all sorts of things that can happen during your hygiene appointment, and how to manage those complications, how to communicate with the patient and your doctor, how to get them involved. And I know this is going to be really useful to you and practical, practicing as a dental hygienist. So we look forward, Dr. Waldman and myself, we look forward to seeing you at the next meeting, December 9th. Always great to see you. We love having our dental hygiene study club with you guys. I wish we had more during the year. If it would be up to me, I would have one every week. But it's just not feasible. So we take what we have. Okay, guys? So see you December 9th.